Hi everyone, my name is BEVERLIN del Rosario. My home institution is Xavier University and my summer program is Hunter College. And we are looking at emotion, dysregulation, and self-harm behavior. So let's start. What exactly is self-harm behavior? Self-harm behavior is any type of behavior done to the self to inflict pain. And we're interested in looking at two types of self-harm behavior: suicide attempts and non-suicidal self-injury. So suicide attempts are done with the intent to end one's life, whereas non-suicidal self-injury, or NSSI, is done without the intent to end one's life. So suicide attempts include like overdosing, severe cutting, hanging. NSSI includes things such as biting, cutting, punching objects, interfering with wound healing, anything done without really trying to end your life. So why are we interested in this? Well, we're interested because suicide, death by suicide, is the second leading cause of death among adolescents and young adults. So a lot of people our age die by suicide. But suicide attempts are even higher than suicide. So why do people engage in these behaviors? If we look at suicide attempters, we see that they engage in suicide attempts because they have this thwarted belongingness where they feel that they don't fit in, they don't belong anywhere, they want to end their lives. They also feel hopeless and they feel that there is no point in living, so they want to die. And sometimes they're just going through so much that they want to escape aversive situations. On the other hand, individuals who engage in non-suicidal self-injury, they want to relieve their stress. They want to discontinue or avoid negative thoughts and feelings. And some people try to punish themselves, but in reality, everyone just really wants to escape whatever emotional or aversive situations they're in. So, with this in mind, we see that there is kind of a trend. Individuals who engage in suicide attempts and NSSI don't really know how to regulate their emotions. So this is where emotion dysregulation comes in. It's the inability to effectively manage stressful situations or cope with emotional distress. And researchers are interested in the way individuals respond to positive and negative emotions or positive and negative affects. For instance, if someone is experiencing a positive affect or a positive emotion, we want to know if they try to enhance that positive affect by focusing on the emotion, or if they're trying to dampen that positive affect by looking for ways to like diminish that positive emotion. And similarly, we're interested in seeing how they respond to negative affect. So for instance, rumination is a maladaptive way of responding to emotional distress in which individuals are continuously thinking about their negative emotion that they're experiencing, say sadness or anger. They're continuously thinking about the causes and the consequences of it, but not necessarily trying to find a solution. This is why rumination is maladaptive. So previous research has examined positive, negative affect in self-harm groups, but not necessarily the variability in self-harm throughout a period of time. And there's like a positive research that shows positive affect regarding self-harm groups, and that's what we are interested in. So we hypothesize that suicide attempters are going to have lower positive affect than the NSSI and the no self-harm group, since they want to end their lives. Similarly, we hypothesize that self-harm groups, both NSSI and suicide attempters, are going to have higher negative affect than the no self-harm group. So in this study, we recruited 43 individuals, 36 were female, ages 18 through 27, and you can see their demographics. And we grouped them according to their self-harm history. So we had the no self-harm group, we had suicide attempters with and without a history of suicide, and we had the NSSI only. There is not really any significant demographic according to groups. So we recruited these individuals from an already ongoing study, and they were screened for self-harm groups. So according to their responses, they were grouped into the group they fit in for self-harm. And for 7 days, they completed an online study journal, an online diary, in which they would answer questionnaires of how they felt throughout the day, and we could use those measures to test our hypothesis. So these measures included the positive and negative affect scale, and this is a measure of current emotions. So how are you feeling right now? This has 20 emotions, and individuals would have to rate on a scale of 1 to 5 from not at all to extremely. So how are you feeling right now? Happy, not at all, to extremely happy. So based on this, we want to know if they experience negative emotions, we use the CERQ to evaluate if they ruminated, that they tended to continuously dwell on their negative emotions or negative affect. If they experience positive emotions, we use the response to positive affect scale to see if they would enhance their positive affect by focusing on the emotion, or if they would try to dampen it or diminish it. So our results indicate that there is no statistical significance in positive affect or negative affect over time. However, we do see some variability among the groups. For instance, if you look at the green one, the NSSI group starts off very high in positive affect, but on the other one, it starts really low on negative affect. On the other hand, the suicide attempters start very low in positive affect, but they start very high in negative affect. When we look at rumination, we see that there is a statistical significance among the groups. Specifically, the NSSI group, the one in green, is consistently higher in rumination than the other two groups, and the suicide attempters is higher than the no self-harm group. When we look at response to positive affect, there is no statistical significance. However, if we look at emotion focus, we can see that the NSSI group is kind of all over the place. There is acute differences in how they manage how they focus on their emotions. So one day they focus, another day they don't, and there's a lot of variability and inconsistency. And dampening, there is no statistical significance, and there isn't really any variability among the groups. So, to conclude, we have seen that there is consistently low positive affect over time among the suicide attempters. So they had very low positive affect, and the NSSI group was distinguished by their high rumination compared to the other groups, and also the suicide attempters had more rumination than the no self-harm group. So we know from previous research that rumination prolongs negative affect, and we know that self-harm groups would, for instance, the NSSI group would engage in non-suicidal self-injury because they want to shift from their negative thoughts and focus on their present stimuli that they're experiencing from the pain. So treatments for NSSI should focus on managing rumination. And similarly, treatments for suicide attempts should focus on positive affect because we saw that suicide attempters were consistently low in positive affect. For future research, it would be nice if this study were to be duplicated, but with a larger sample, since we only have 43 individuals, if they would have clinical participants, since our study included only college students and they were non-clinical, and if they would have multiple assessments per day for a longer period of time. So maybe for 2 weeks, if they would assess their emotions twice a day so that we can have more data and see the variability more accurately. So I would like to thank my mentor and my lab members and Hunter College for this opportunity. Any questions?